Hello, Dr. Huffman from American Bariatric Centers and American Bariatric Centers Direct. This video will cover bariatric medications or weight loss medications, a general concept. This is not meant to be a detailed presentation on the dosing and side effects of all drugs. If you have questions about specifics on dosing, side effects, interactions, contact me directly at 866-270-5116. I'll work with your clinical team to ensure that they understand the nuances of the treatments of obesity through the use of weight loss medications. Now, weight loss medications have been around for quite some time. Back in the 90s, we used a combination called fen-phen. That was phentermine and fenfluramine. Now, there were potential risks with the fenfluramines, but the phentermines, which have actually been around since the late 1950s, are very, very safe and are the mainstay of anorectic treatments today. Phentermine is a Schedule 4, and it does not cause any addiction. There's no concerns for diversion or addiction. It's Schedule 4, not Schedule 2. Schedule 2 drugs are addictive. And an example of that are amphetamines that we used back in the 60s. And currently we use a lot of that in our children, unfortunately, with the ADHD drugs such as Ritalin and Adderall. Those are Schedule 2 amphetamines, very addictive, very dangerous. Schedule 4 are not addictive. There's no studies to show they're addictive. They're very safe. They are monitored closely, and there's variations in each state medical board. So some states will allow you to prescribe phentermine as long as the physician feels it's necessary. Other states, particularly like Ohio and Mississippi, some of the states are, I consider, backwards. They believe that obesity is a cosmetic issue and that it should be cured in 12 weeks. That's what the medical board of Ohio State told me, that obesity is cured in 12 weeks of use of phentermine. And they just don't understand that it's a chronic disease. But contact me again if you have any questions about your state. I know what rules and regulations apply in each state. So phentermine is a very safe drug. You hear a lot about it. It goes under the brand name of Ionamin and Adipex P. Another drug that I like a lot is Tenuate. Tenuate's an old anorectic. My grandmother took this back in the 60s. Very, very safe. It's generically diethylpropion. The parent drug to bupropion, which is Wellbutrin, a antidepressant. People get on Tenuate, their moods improve, their appetite goes down. It's not as stimulating as phentermine, and that's what I like about it. If you're sensitive to caffeine or other stimulants, you'd be better off with Tenuate. And that comes in doses of 25 milligrams, 75 milligrams, where phentermine comes in 15, 30 milligrams, and 37.5s. So those are two of the Schedule 4. There's a Schedule 3 medication. The higher up the scheduling ladder you go, they consider more addictive. So Schedule 2 amphetamines are addictive. Schedule 3, a little more risk there, and that is phendimetrazine or Bontril. I didn't think it was any different. In fact, I thought it had less stimulating effects than phentermine. So I'm not sure why it gets scheduled that way, but it's another good alternative to people who have used phentermine and can't seem to get anywhere with it. They said, geez, doc, I've used the phentermine at work, but now it's not working. So we switch them to Bontril. The other thing to keep in mind when you're on an anorectic medication is you'll build up a sensitivity to that drug. It may work very well for 12, 16 weeks, and then all of a sudden they're not working. Now you can bump the dose up and they'll work again, but then you'll get to a point where you're at maximum dose and it still doesn't work. At this point, we recommend you go off the medication. Stop the medication, allow the neuroreceptors to become sensitized to that drug again, and then restart it. Now, the problem is if you go off it, your hunger is going to go up. If you go off an anorectic, I always put my patients on a VLCD or a very low calorie diet and create a natural appetite suppressant through the ketosis. If you want to learn more about the VLCD, go to the diet plans link on this website. So there are some newer medications we have out now. Qsymia is one. Now Qsymia is a combination of two medications, phentermine, which we discussed earlier, and topiramate, which is an anti-seizure drug. Now I used these drugs off-label 10 years ago and found them to be very effective with some of my weight loss patients. These medications have to be monitored carefully, however, because the topiramate agent can cause birth defect. So when does this happen? In the first trimester. And so most of the patients that came to us in weight loss centers were females. Females just seemed to be more attuned to their weight and the weight issues and health and wanted to get their weight down. I didn't see men until they had amputations of their feet or they had the first heart attack. But women got in sooner. So most of our patients are females. Most of them are in the fertile age of 20 to 50. So you have to be very careful with the Qsymia. It's a very safe medication in the right hands, must be monitored carefully. Another new drug out that was approved recently is Belviq, lorcaserin. And lorcaserin is an SSRI. It looks a little bit like the old antidepressants a bit. We did have some effect early on in using some antidepressants like Wellbutrin and Zoloft for weight loss. And lorcaserin seems to have some benefits as well. So lorcaserin, Qsymia, phentermine under the name of Adipex, iodomin, or just phentermine, diethylpropran under the name of Tenuate, or Bontrol are all examples of anorectic medications that can be used. So if you have any more questions, go through our PDF downloads. There's a lot of information there about the use of anorectic medications. There's sheets for you to give to patients as handouts. But have your medical team contact me. If you're an ABC Direct member, contact me personally and I'll help you and your clinician. If you don't have a clinician, let's find you one. That's part of our job as a partner at American Bariatric Centers Direct. We will help you find a physician. If you want to open a brick and mortar location, we'll help you with that. If you're going to run a web-based support group meeting, we'll help you with that. So we're here to help you grow. So if you want to get into the use of medications along with your functional foods and your nutritional behavioral weight loss programs, contact us and we'll be glad to help at 1-866-270-5116. Thank you.